Hey everyone, and welcome to this explainer. Today, we are diving into a super clear, step-by-step breakdown of exactly what happens after breast augmentation. We've synthesized direct medical advice from top plastic surgeons to build you a completely bilingual, English and Chinese, visual roadmap for your recovery. We're talking the 5 crucial recovery steps, secrets for quick healing, exactly how your diet affects your downtime, and how to safely resume exercise. We are skipping the fluff and getting straight into the clinical directives so you can heal beautifully and safely. Let's get right into it.
Here is our game plan for today. We'll cover 5 focus stages. First, the 5 recovery steps. Second, the first 24 hours. Third, your quick healing diet. Fourth, safely resuming exercise. And finally, long-term scar care.
All right, kicking things off with Section 1, the 5 recovery steps.
It's actually surprising how simple but absolutely crucial these 5 foundational steps from Dr. Carlson really are. Step 1, and this is a biggie. Lower your items at home. After surgery, your arm movement is going to be heavily restricted. You literally cannot lift your arms above 90 degrees, and you can't lift anything over 10 pounds. So move everything off those high shelves right now. Step 2, fill your prescriptions early. You're going to be groggy from the anesthesia, and honestly, the absolute last thing you'll want to do is navigate a pharmacy. Step 3, prep your meals for the first week to give your body a massive running start on healing. Step 4, secure 24-hour help. You really need someone around to watch the kids, make your meals, and just help you out while you reacclimate to life post-anesthesia. And Step 5, have comfortable, loose-fitting clothes ready. Think sweatpants and baggy zip-up shirts that can easily slide over your surgical bra.
Moving right along to Section 2, the first 24 hours.
So this is a massive shift in modern post-operative care. A lot of patients just assume they're going to need heavy narcotics like Percocet, right? But the reality is, those drugs often cause severe nausea and grogginess. Instead, modern surgeons are using what's called the ERAS protocol. That stands for Enhanced Recovery After Surgery. Under this protocol, surgeons actually encourage you to manage your pain primarily with just 400 milligrams of over-the-counter ibuprofen. And get this, studies show that for this specific type of pain, ibuprofen works just as well as morphine, but entirely without making you sick to your stomach. Dr. Hall even notes that out of 100 women, about 20 won't touch the narcotics at all. Some might even go out to dinner the very next night, relying purely on Advil. Pretty amazing, right?
Okay, so what exactly should you be doing on day 1? Well, here are your precise directives. First up, sleep with your head elevated on 2 to 3 pillows. Do not sleep flat on your chest. Elevating your head helps immensely with the inevitable post-op swelling. Second, when you get home from the hospital, limit your nap to only 2 hours. You actually want to get up and get a little bit of movement in so you can sleep completely through the night later. Third, light arm movement, like, say, washing your hair, is actually encouraged. Don't just freeze up. Fourth, you can shower as soon as you're ready, whether that's day 1 or day 2, assuming your surgeon uses waterproof dressings, of course. But, and this is crucial, absolutely no baths. Soaking in a tub is a guaranteed way to lift those dressings right off and expose your incisions. Definitely avoid that.
Next up, Section 3, diet for quick healing.
What you put into your body directly impacts how fast you heal, so knowing what helps and what harms is absolutely crucial. On the do-consume side, load up on high protein. Your body is working overtime to heal those incisions, so things like protein shakes or even a classic steak and potatoes are highly recommended. Also, if you're feeling nauseous later in the day, here's a secret. It's often not the anesthesia causing it. It's usually from dehydration or taking your meds on an empty stomach. Surgeons actually recommend drinking something with real sugar in it, like a real full-sugar Coke or ginger ale, just to settle your stomach. Now for the don't-consume side. You need to stop taking fish oil or omega-3 pills 2 weeks before and after your surgery. I know, it sounds super healthy, right? But it actually drastically increases your risk of internal bleeding. The exact same goes for aspirin. And smoking? Well, Dr. Hall shares a truly wild statistic here. A single cigarette in the month before surgery literally doubles your risk of infection. Just one. So stay incredibly far away from smoke, and yes, that includes secondhand.
Moving into Section 4, safely resuming exercise. I found this advice from Dr. Jonathan D. Hall to be incredibly striking. He says, and I quote, "Rest your breast for 6 weeks." That's probably the most important part of this whole explainer. I'm going to say it again just so it sticks. Rest the breast. Look, even if you feel perfectly fine a week later, your internal incisions are still incredibly weak. This is absolutely not a no pain, no gain situation. Pushing yourself too early can literally cause internal blood vessels to pop open, which leads to hematomas, or cause your scars to stretch out and widen permanently. Just don't risk it.
Let's break this down into a really clear timeline for you.
On the exact same day of your surgery, walking around on flat ground and gentle range of motion are allowed and actually encouraged to prevent stiffness. But from weeks 1 to 3, you are in the danger zone. Your incisions are at their absolute weakest point right around week 3, so do not lift anything heavier than 5 pounds. Now, at weeks 3 to 4, we see a bit of a split in surgical approaches. Some surgeons have what's called a rapid recovery program, like Dr. Peter Felisa, for example. He uses specific surgical techniques and medications to minimize tissue trauma. Under his specific program, some patients are actually cleared for full cardiovascular activity at just 3 to 4 weeks. However, for standard procedures, the universal golden rule is to wait the full 6 weeks. After 6 weeks, those restrictions are generally lifted and you can transition right back into your standard bras.
And finally, Section 5, long-term scar care.
So this is the question every single patient asks once that initial swelling finally goes down. You look down at your incisions and you can't help but wonder, how do I make these scars completely invisible? And how do I actually take care of these implants for the next decade?
First off, let's bust a massive, super outdated myth. In the past, patients were told they needed to vigorously massage their implants to keep them loose and prevent capsular contracture. Modern surgeons are telling us this is totally outdated. In fact, if you have textured implants that are designed to grip the tissue, vigorously moving them around will actually ruin your result. Only a very light, gentle massage is recommended just to help your body adapt. Now, as for those scars, to flatten them out, you really don't need fancy, expensive creams. Surgeons highly recommend using 3M micropore tape. It's incredibly cheap, like maybe $2 a roll, and it works almost perfectly, just like expensive silicone sheeting to trigger the scar tissue to flatten out. It literally transforms a rough Brillo pad texture into a smooth, woven fabric texture. So keep your scars taped up or covered with silicone strips for a few months to get the absolute best results.
Finally, I want to leave you with a highly specific, proactive strategy for your long-term health, and that number is 9 years. Here in the US, major implant companies generally provide warranties, and those usually run out at the 10-year mark. While your implants absolutely can last 20 years, the rupture rates do slowly increase over time. Because of this, Dr. Hall recommends scheduling a high-definition ultrasound of your breast precisely at year 9. It's a brilliant move, really, because it allows you to catch any silent ruptures right before your standard 10-year warranty expires. That one little appointment could save you potentially thousands of dollars in replacement costs down the road. And there you have it, the complete roadmap to your recovery. But before we wrap up, I want you to ask yourself, are you truly prepared to prioritize that strict 6-week resting period to protect your investment? Keep all these insights in mind, and you are going to set yourself up for an incredibly safe, beautiful recovery. Thanks for joining me on this explainer today, and as always, keep learning.